Hi everyone, I'm Dr. Nupur Khare. I'm an internal medicine resident in Germany and I'm a mom of two, and I'm currently on an unexpectedly long break because my maternity break turned into a sick break sick leave when my ACL got injured and I had to get it operated. In this video, I wanted to be a little more structured and less rambly, and I wanted to go over my experience of first getting the injury and then getting the diagnosis, and then how the surgery went and how the first 2 weeks post surgery were. I will try to be concise and to the point, but if I feel like the video is too long, maybe I'll divide it in two parts. So let's get into it. First things first, how did I get injured, or what was the mechanism of injury? So I was playing cricket with my friends and we were in a coaching session. I was not playing as much as I was helping other people play. I was basically standing on the sidelines waiting for my turn, and I saw the ball go past me and I wanted to stop the ball. I moved a few steps sideways and I realized I couldn't reach it by my hand, so I stopped it with my foot. Not recommended. And in that moment, my weight was on my left leg, and it got stuck in a rabbit hole, and that's why it twisted. So, if you usually hear about ACL injuries, this is not a very typical fashion of how this happens, but the idea is the same, that the weight is on your more than normal weight, more of your weight is on one part of your body and it twists or it pivots and the ACL breaks. This is that kind of a freak accident which could have happened anywhere, and like I didn't make any unique movements as such. Running sideways or running a little bit is usually safe, but the way to see it is that it is an accident and it can happen, and sometimes you drive on the wrong side and you come back home safely, and sometimes you are doing everything you can and you're doing everything right, you're following all the rules, but still someone comes and rams into your car. So it's one of those things which just happened because it happened. Yeah, so that is how I got injured. I've also heard stories about people getting injured in the gym, and I've also heard stories now that I discuss with my friends, like somebody dancing and it got getting injured. So it's a relatively common injury, and it's not only seen in athletes, it can happen to anyone. The next question is, how did it feel? So what were the initial signs and symptoms? In that case also, I might be an outlier, but I want to say my story so that you know that sometimes it can present with these type of symptoms as well. In that moment, when I twisted my knee, I felt a snap, or I heard a snap, I'm not sure, but I felt it, that something has happened. And then there was a sharp shooting pain, and it was very, very high intensity pain, which took my breath away. So I didn't fall down because of the pain, but because the pain was so much, I had to sit down on the ground. So till now I'm moving around and I've not fallen down, and then this snap kind of thing happens and I feel so much in pain that I have to sit down. So this is what happened, and then slowly in the next few minutes it kind of relented, it became less, and I kind of went to the sides and took a break. I thought 30 minutes and this will be okay again. Thankfully, better and smarter people were there on the field than me, and my husband also saw me flinch in pain, and my friend who is the coach as well, he also saw it, and they both basically forbade me to play. But initially my instinct was, because after 30 minutes the pain did dull down to an extent where I didn't feel it at rest anymore, and my instinct was to go and play again, because I came there, it was a beautiful Saturday morning, I went out, I wanted to play. That was the entire reason I was on the ground that day. So I somehow wanted to push my body and I wanted to play. And I think that's just an instinct you have as somebody who likes the outdoors or who likes movement, that you want to be a part of everyone else. You will want to be a part of the team, you want to play. Thankfully, those instincts were completely damped down by my coach and also by my husband, and they told shut it down completely, that he should not play. And if I had continued to play, I'm sure I would have injured more than just my ACL, because knee is made up of so many ligaments, and one ligament being out of whack would have mean that maybe my MCL, PCL could have also been injured, or my meniscus could have been injured. This particular incident caused just an isolated ACL injury, and as far as injury goes, it was relatively on the easier side of the spectrum compared to how much more complicated it could have been. Then I came back home and I asked my friend to check me. I mean, my friend who's a colleague and who is also an orthopedic surgeon. He saw me, the pain was barely there, and the swelling was also almost negligible, or I would not even say there was swelling compared to my other leg. And it was not very obvious what is going on. So it was kind of that kind of thing where I just forgot, because my tickets to India were already booked. I was super busy, and I had to pack and I had to plan everything. And also in the meantime, my younger son's birthday was coming up, so we had to prepare for his birthday party. So basically I had no time to really think about it. But what kept on happening during these weeks, like I was 2 weeks away from my flight to India, and what kept on happening here and there was I would just suddenly feel my knee give away. So I would be on my entire weight would be on my one leg, and I would feel poop, as if there is no knee anymore for like a few seconds, and it would just give away. I would feel like I'm buckling, and then it would happen for seconds. It won't even be long enough that I would actually fall down, because then the rest of the body would take over. And I still had my complete range of motion. There was no limitation of movement for me. So I was also down on my sconces. I was packing bags on my knee, completely on the ground. I was, and in those moments, like when my knee was flexed beyond, like to the max, that is when sometimes I would feel a little discomfort. So they were very mild symptoms as such, and I got lucky because my full range of mobility was there. But these type of stories are also a little bit, they tell you how varied the symptoms can be, and then if you don't get something like this checked, there is no way to actually know what is going on. On the flight to India, by that time, like by 2 weeks, I was so pain-free and so like relaxed about it that I almost forgot that this was also a thing. But then again on the flight, I felt it giving away, and that is when I decided that no matter what happens, I will get it checked when I'm in India. And then I came to India, and as we all are super spoiled here, we can just get any type of investigations done without any waiting time. I went into a radiology clinic and got an MRI of my knee on the suggestion of my father, because there is no other investigation which can show you exactly what the ligament looks like, because X-rays and CTs are more for bones, and we were suspecting there was no bone break clearly, so we were suspecting something else. I was basically suspecting that there will be a small grade of tear, because I was, like I said, I was pain-free and the swelling was bare minimum, or like not even there by that time. So yeah, then we got our MRI done. So now we are at the diagnosis stage. I got my MRI film and I went to the surgeon my father holds in very high regard and completely trusts. So we went to him, and when he examined me, for him it was pretty clear because he specializes in primarily sports injuries. So when he saw my knee, he said, "Your history is very typical of ACL tear." And when he saw the MRI, we he saw that it was a grade 3 tear. So for laymen, the easiest way I can explain is that grade 1 tear, there are some fibers which got broken. Grade 2 is like more than that. A huge number of fibers of the ligament got broken, but the ligament is still holding together somehow. But grade 3 is that they are broken enough that they are separated. So at this point, the ideal what to do next is, there is, for someone who is young and who is basically not having any health issues, there is not, that doesn't make any sense to go the conservative way, because um, it will take months of rehab to maybe get to some place of improvement with in terms of the ligament repair. And even after that, there's a chance that the conservative treatment would fail and I would still need the surgery. I am in my situation where I am a mom of two, and I actively have to do a lot of stuff at home. We don't have any house help, as every expat knows that that problem. So I have to run my house, I have to take care of my kids. I also have to work, and at work I also usually walk around 5,000, 6,000 steps. And beyond that, I am a dancer. I have danced my entire life. Playing and everything just comes naturally, but dancing is something which I cannot imagine my life without. So I did not want any restrictions in my mobility, and I cannot afford the time it would need to experiment with a non-surgical approach. And with the textbooks and all, the ideal way to go for a grade 3 tier is surgery. So at the end of the day, we decided to get the surgery, and we hoped that we would get a date as soon as possible. There was a huge waiting list, but thankfully thankfully someone backed out, and we on our upon our request, we could they slid us in when someone else backed out. So the surgery also happened in a timeline which would make it possible for me to go back to Germany with my original flight tickets. So the surgery date we got was 5 weeks before flying out of India. So we were hoping that there will be enough time for me to be a little more stable, for me to kind of be able to live my life in Germany without much help. I mean, my husband will still need to chip in a lot more than he would usually need to, but with the two of us, we hopefully could manage. That was the idea. So now let's talk about the feelings and also the expectations and the fears and the hopes and everything. Sappy, let's go into that a little bit. There is one entire part of what the surgeon tells you. My surgeon, like I said, is super experienced, and he was like, yeah, 30 minutes in and out, it's a very simple procedure, not a big deal at all, we could easily do this, and you will have a chance at a normal life eventually. But the timeline which he gave me was that it would take me 2 weeks for stitch removal, 4 weeks to be able to bend 2 weeks to be able to bend my knee to 90, and we will keep the knee bending at 90 and not more until 4 weeks. From 4 to 6 weeks, we will start to aim at full range of motion, that is to bend my injured knee as far as my normal knee would bend. And 3 months to go back to cycling and to go back to jogging, to normal work life, and 6 months hopefully to go back to sports. and 9 months to go back to dancing, because dancing is a lot more, it requires a lot more movements of the knee, and it requires a lot more knee stability than a usual game of cricket or running would. So this was the timeline which was suggested to me, that was the expectation. And now I'm on this side listening to all of this, and I could just blindly believe this and make myself feel a little better, but there are still fears. The biggest thing is the ability to go back to work. Will I feel normal again? Will I actually be able to do all of these things again or not? All of these things are there, and then on the top of it, it is an elective procedure, right? So you do question this choice, like, do I really need this? Even though it was pretty clear for me that I need this, and I also am too young to accept any loss of mobility or any sort of restriction in my movement, but it's still, we as doctors, we also read a lot of outlying cases, we read a lot of complications, we know too many things, there is too much knowledge in my head to kind of just just go into any procedure without having any apprehensions. Like, on one hand, you also know this is a very routine, very normal, very clean surgery, and on the other hand, you also know that the risks, I have names for those risks, I have names and pictures in my mind for those complications which happen, like 1 in a million, 1 in a billion, but there are things which is very which are in your head, and it is very hard to keep yourself calm about these things. With all of this, the biggest thing in forefront for me was were my kids. And from the my husband had to go back to Germany because of his work, and I was alone when I got the surgery. I mean, I was with my parents, but I was still alone, and I had to leave my babies in the care of my parents for 2-3 days, which might seem very normal for Indian kids and Indian parents, because they are used to their grandparents, they're used to being without their parents. But for nuclear families like us, who are living abroad, our kids are not used to not seeing us, both of us. Like, at least if one of us is there, it's not that big a deal, but both of us not being there, and it is also not a very relatable thing for example, my 3-year-old kid. If I tell him I'm going to work and I'm having a night duty and I'll come tomorrow, he's okay with that because he knows what that means. But telling him I'm going to the hospital and coming back injured, coming back with a big brace and walking with a walker and all of those things, I was afraid on his behalf for him, and I was very anxious about how all of that would go. So yeah, there were like personal worries, and then there was these worries. On the night of the operation, I think I was dreaming about what if I lose my leg, and all those sorts of crazy thoughts were there in my head. But we have very experienced surgeons in our country, and surgery is a very controlled environment. So the chances of anything going wrong are so less that you have to at some point just bite the bullet and accept that the control might not be in your hand, but it is in someone's hand, and they will take care. Now I'll quickly go into the experience of the surgery itself and the anesthesia, and I think then I'll sign off because I think this video is getting too long. So the experience of post-op and the first 2 weeks and the goals set for the next 2 weeks, I would discuss in the next video, in the part 2 of this video. So okay, so on the day of, before the surgery, you of course have to get this anesthetic checkup, and they need to give you a clear bill of health, which is again one more place where you realize that if something would be wrong with you, they would also not take the risk and operate. So my anesthetist explained that it would be a spinal anesthesia procedure, which is something I already knew. Spinal anesthesia means basically you are numbed from your waist down, in this case, because the surgery is only on the limb, and you are awake for the surgery. You can choose to take a sedative and sleep through the surgery if you don't want to experience anything at all. I was very in two minds, and at the end I decided to just be awake because I thought it might be cool to see what the surgery is like. So yeah, so I got the spinal anesthesia, and I think there's a lot of description about how spinal anesthesia looks like in terms of the needles and everything. I would just say by the time you're in the OT and there are so many people around you, you have been prepped, and all of those things are happening. There is no time for you to be scared, and there is also no it's not as big a deal as it looks. So they also numb you before putting the needle in your spine, and yeah, so I was awake for the procedure. I could feel a little pull and push, but I felt no pain, if that's one of the concerns which people have. But yeah, you're awake. You can't see anything because they put a curtain up, and so you will not need to be freaked out by the visions of the operating table. But yeah, so you are awake and you see what's going, I mean, you can see people around you. It felt even shorter than the 30 minutes I was told, because it really felt like they went in and out too quickly. And soon my surgeon was showing me my new ligament. It looked pretty cool on the screen, because they do it with an arthroscope, which means they put a small flexible pipe which has vision at the end of it, and this you can see on the screen how the inner side of your knee looks. And yeah, that was pretty much it. It didn't feel long enough. I felt it got done really quickly, and I was awake the whole time, and I think it went as smoothly as it could. So now I think this is where I'll sign off. I don't want this video to get too long. In the next video, I will talk about the experience of the day of operation, and then post-op day 1 and 2, and also the entire first 2 weeks until the switch removal, and a little bit about what the exercises initially were expected of me, and what was my mobility like in the first few days after the operation, so you know what to expect post-operation. So yeah, until that video, I'll say bye. See you.